We've talked a lot on this program about how long it takes to see a paediatrician and access child development services. And so many of you have been in touch over this in the last year. Now, if you've spoken to me before about this, I would like to know if you were still waiting. Did you manage to get an appointment? How far away is it? Give me a call on 1300 222 720. Here's where things are at right now, and this is in the public system. 15 months to see a paediatrician. This is for kids, right? 15 months to see a paediatrician. Almost 13 months to see a clinical psychologist. 8 months to see an occupational therapist. And 8 months to see a speech pathologist. And then look at the waiting lists because they're huge. 5,944 kids waiting to see a paediatrician in Perth. Plus add to that the 1,000 more in the country. Then you've got 1,722 on the list for a clinical psych, 3,739 for an OT, and more than 5,000 waiting to see a speech pathologist. And in the private system, a lot of specialists have actually closed their books. Now, there is some action on this front with a parliamentary inquiry being set up to look at the issue. Liberal MP Donna Faragher, who is also the Shadow Minister for Youth and Early Childhood Learning, pushed for the inquiry, and she's with me now. Good morning to you. Thanks for your time.
Thanks for having me today, Nadia.
How dire has this situation become?
Well, the figures that you've just read out, I think, say it all. The fact is that we have over 17,000 children right now waiting on wait lists for allied health services and paediatricians just in metropolitan Perth alone. The fact that we've got both in metropolitan and country WA 6,969 kids waiting to see a paediatrician tells me that we've got a problem in this state.
How long has this been a problem for, Donna? I mean, we've been talking a lot about it over the last 12 months. Has it been an issue before that?
Yes, it has. And I think, all governments at different points in time have had challenges with respect to this area. But what I am being told, that certainly in the last couple of years, it has increased. And I have been following, like you, Nadia, I know this is an important issue for you. I've been tracking figures with regard to the median wait times for some time, and they are ever increasing. And the fact that we have people waiting at least 15 months. Many families tell me it's actually a lot longer than that. So these are the medium times, but many people are waiting 2-3 years to actually access these services.
And we're talking about children, and in a lot of these cases, these are developmental issues. Time is of the essence here, is that right?
Absolutely. Children do not have time to wait. The importance of early intervention is well known. It's well known in research. It's well known across the board. The earlier we intervene, the better the outcome. And what we need to ensure is that children are actually getting these services when they need it most. And the fact is if a child is having difficulty hearing, they're not learning at school. If they're having difficulty communicating, that will impact them in terms of how they communicate with their family, with their teachers, how they communicate and make friends in the playground. It really is hard for these kids, and we actually need to try and find ways to get improvements in the system and to reduce these wait times.
And you mentioned schools there, and it does then put pressure on teachers and staff because obviously they're waiting for assessments and maybe even a diagnosis outside the school system. I guess in the meantime then a lot of these parents would rely on some extra assistance in the school, but it's obviously putting pressure on staff and teachers as well.
Absolutely. And I will say that every time I visit a school, I would say that issues in terms of access to services would be in the top 3 issues that are raised with me with principals. They are, like parents and other health professionals, they're at their wits' end because they want to do their very best to help their students, but when they're on waiting lists that are very, very long, they are limited also on what they can do to help these students.
I'm going to go to parents in just a moment. 1300 222 720 if you want to tell me what this has been like for you, if you are navigating this system and trying to get an appointment, trying to get assistance for your child. You can text as well on 0437 922 720. I'm speaking with Donna Faragher, who is the Shadow Minister for Early Childhood Learning. You pushed for this parliamentary inquiry. A petition was also presented to the Parliament. What will this inquiry actually look at?
Well, the committee will be able to inquire into, firstly, the child development services themselves, but also the role of specialist medical colleges and universities in relation to workforce, but importantly, opportunities to increase engagement and collaboration with the non-government sector, and also being prepared to look outside the box and seeing what other states do and how that might have applicability to this state. Because what I'm being told is that whilst there are issues in terms of workforce, there are actually ways, even with the available resources that we have, that we could make improvements. And I think we need to be able to hear from experts, those in the field, and actually hear what they have to say, because there are opportunities to improve the services as they currently stand.
You wanted, as part of this inquiry, to be able to look at the impact of delays to accessing these services on a child's overall development, health and well-being. This was amended by the government. Why was that taken out, and does that disappoint you?
Well, yes, it does disappoint me. I had sought to ensure that as part of the inquiry, we would look at the critical importance of early access to these services and the impact of delay on children. Both of those issues go hand in hand with this issue. The government decided that they didn't want that, and they simply want us to look at the role of child development services. We know what the role of child development services are, but I wanted to ensure that we looked at it in the context of the whole child and the impact on that child. The government decided not to agree to that particular aspect. We came to agreement on most parts of the terms of reference, and I still think, despite that, we actually have a strong terms of reference, and there is certainly an opportunity to get some good outcomes through this committee. What
are potential solutions here? Because when we've spoken about this before, one of the issues is actually a lack of specialists and a lack of doctors.
Look, I think there are a range of opportunities, and certainly when I speak to people both in the government and non-government sector, they've indicated to me that yes, there are issues surrounding workforce shortages, but there are opportunities. There are opportunities perhaps with regard to greater involvement of child health nurses, actually providing hubs, I suppose, in terms of assessments, and also providing opportunities, and this is something I've been very strongly advocating for some time, is actually bringing allied health services directly into schools. We are actually, as a state, lagging behind most other states and territories who actually have allied health services, speech pathology services being provided directly into schools, much like the school psychology service that we currently have.
So they'd actually be based in schools, and then servicing schools in that area?
Yeah, what a number of other states and territories do is they actually have speech pathologists working in clusters of schools. So they will go out, you'll have speech pathologists going out to a group of schools in their area, and they'll actually provide direct face-to-face support to those students. And that's a really important thing, because you're actually having it at the school, and that means also then the speech pathologist has got good contact with their teachers as well. So it's a win for both the students and also the teachers as well.
So that's one potential solution. And that's interesting. I've not heard that before suggested, Donna Faragher. So I wonder if people would support something like this beyond speech pathologists. Could you have other allied health services there?
I'd certainly like to see it. I think that I would see that speech pathology would be the first step. Yep. And certainly it is something that has been supported and is supported by many people. But I would actually like to see it extended to other allied health services as well, bringing the services to where the children actually are. That's at school. And I think that you've got a captive audience there. You're going to see a lot more kids, and it actually is going to have a benefit, and you're going to have less kids missing out.
We'll leave it there, and I do appreciate your time. We will watch with interest this parliamentary inquiry and certainly a report that I think we'll get, hopefully, in the next year or so. That was Donna Faragher, Shadow Minister for Early Childhood Learning.